Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call. Hey everybody, this is Di McQueen, and this is Healing Families Shattered by Addiction. Today I'm joined with my partner in crime, Dr. Brian Jackson. Hey Bri, how are you?
Hey Di, good. I'm good. Good to see you.
Thanks, good to see you too. I know it's been a little bit since we did one together, so I go, let's, I think we have a really cool topic today, don't you?
Yeah, I do. I think it's important that we kind of make sure that people understand that there are different choices in terms of recovery, both on the family side and on the side of the person who has the addiction.
Yeah, so what we were thinking about talking about today is that, what happens a lot for Brian and I is we get people that go, they come in with this idea that there's sort of a one size fits all, and there's one template that fits, both the addiction side and the family of addiction side. And the fact is that's not true. Brian and I have lots and lots of interventions that we try, and it's really important as someone gets healthier and healthier on either side of the aisle that they start to recognize that as they find out who they are, they will also discover things that work for them or don't work for them. And that's not a wrong or right thing. The one thing that we ask is that people give it a chance, right? Like we give a suggestion and we'll go, hey, why don't you try this and see how this might work for you? And, if it doesn't work, then let's figure out, where we can go from here. So, I think that's true. Don't you, B? I think we come across that.
Yeah. So I think that, in the past, it's like cast the same net for everybody, that everybody has to go to AA and 90 meetings in 90 days. And, families have to go to Al-Anon, X amount of time. And, and that's the answer. So, our philosophy and what we're doing is a little bit different. It's more kind of a buffet approach, if you will. For some people, AA is fantastic and they like it. Other people really are not comfortable there. But if you look at the buffet, like the buffet could be AA meetings. Okay, develop a sober network of friends, or develop a network of friends who are families who may have the same condition. So if we go jump from the person in recovery to the families, so accountability partners are very, very important. They like to say sponsor. I'm more comfortable with accountability partners. So if you can be rigorously honest with another family about what's going on, if you're the family, or if you're the person that is, in recovery, if you can be rigorously honest with another human being. And then there's, proper nutrition, reasonable exercise for those that are seeking a spiritual life. There's prayer and or meditation. But what we're trying to do is understand the dynamics of a family and the dynamics of the individuals within that family, be it the family of the loved one or the loved one. And if you just dictate one size fits all, that I don't think is very much thinking outside the box, if you will. So it's almost like going to a restaurant. So there's thousands of restaurants in Jacksonville, Florida. So if you go to one and the food is not that great, would you go back again? Probably not. You would probably try something different. And I don't know that this is a good analogy, but you might find that, okay, having an accountability partner and a sober network of friends is really giving me more than the AA meetings are giving me. Or there may be people that all of that is really good for them. Or exercise. We're finding out more and more that the importance of exercise, not only for recovery, but for emotional distress, be it depression and or anxiety.
All right.
So all
That's a huge
kinds of
one.
things, and then maybe even medication assisted treatment, rule in, rule out. People may need that. So
Yeah, absolutely. I mean, that's, that was something I was going to bring up for sure, which is, medical assisted treatment. We have strong beliefs in the system. And if someone needs chemistry, we must, in fact, address that. And, we find it really important for someone to get the help they need through that arena if necessary, right? If not necessary, then of course not. But, the other studies show people that have had trauma, they're going to be addressing issues a little differently than someone that just, maybe had picked up something. Or if the family members, for instance, it's hard for them to understand. So they get something in their minds of how an addict should be acting or reacting. And it's our job to try to help them discern why they may not understand what's really going on, and help both sides kind of see each other's language. And, I think that's where, we have spent years trying to sort of help people when we have new ideas and there's new evidence based information. The operative word is evidence based, right? We try really hard to work within the guidelines of things that we know research has been done on. There's tremendous research now on, keeping your nervous system, regulated, right? By uses of things like meditation and yoga and just gentle practices of talking to each other, through both the family members and the addict themselves. The way that we speak to ourselves in general, right? Most of us are pretty harsh and we haven't learned how to be gentle with ourselves yet. And it's very, very important if we're going to make progress to understand it's not going to be a perfectly straight line. We see things that move up and down, they're fluid, they're ever changing. But I think the most important thing that both Brian and I are trying to stress to you is that both sides of the aisle need to make sure that they're working within what does work for them and doesn't. But if it doesn't work, we like to talk through it, as to why. Is it just a fear based thing? If that's the case, we might ask you and encourage you to do it again. If it's something that there's a viable reason why, after one or two tries, we recognize that this is not the appropriate direction for this person because it just does not work for who they are or what they believe, then we always go, there's more. There's always, at least to date, we have always been able to find different interventions that people can grab a hold of if they're willing to do the work. Do you agree, B?
yeah, so it's very important, to recognize that maybe some of the things or the ways that the family dynamics are interacting are not working. It's kind of like doing the same thing over and over again, the sparring, the finger pointing, the name calling, all of that stuff. And I'm not saying it's the same for everybody, but we have a tendency to fall into a pattern. And it's almost like a railroad track. That's the same railroad track we go down over and over. Nothing really changes. So what we're trying to do is get you to get if you will, a new pair of glasses, is what we're trying to install in terms of the way you look at this, you frame this, and how we can do different things. Because again, we've been doing the same thing and nothing's changed. So why not take the risk of doing something new? It cannot get worse. I promise you that some of the suggestions that we will make will not make the situation worse. And when I say the situation worse, I mean for the family members and for the person suffering from addiction. So, you know, where it becomes just such a negative environment, it's really hard to find any joy. And so we're trying to separate the illness that affects the whole family from living life. And we want you to be able to live life in spite of the fact that some family member has an illness. So if we're all basing our happiness and joy in life contingent upon a person getting help and getting well, we're really setting ourselves up for something external to make us happy. But we want to be able to help you live your life in spite of, as opposed to it being the be all and end all in terms of turning the whole family system around.
Right.
So,
And one of the things I noticed is that when people say to me, this is so uncomfortable, I always suggest to them, and I know you do as well, B, that if it's uncomfortable, they're probably doing something healthy, right? When we continue to do what we've always been doing, that is comfortable because we know how the result is going to end up and we know what to do with that, or at least we think we do. But when we ask you to get a little bit uncomfortable and step outside that box that of course it's going to be uncomfortable at first until you kind of settle in to new behaviors and new functional ways of doing life. And for the family member, the idea is to understand that we need you, or we're going to try to help you continue to be able to live your best life, whether the alcoholic addict is drinking, drugging, shopping, or whatever else they're doing that's causing so much upheaval to the family. So important. At the same time, we want to work with, or have others work with, the addicted side so they too can stabilize and the dance becomes a lot more fluid between everybody, right? That's the importance of all of this, which is so many interventions. There's so many wonderful tools out there today. And even if, let's say, someone went to AA, for instance, even inside the rooms, right? They may not, not every single thing that is suggested is going to be something that they can feel comfortable with. And that's okay. I always go, hey, if you can acquire more tools in your toolbox, it gives you options and choices. And of course, not every single thing is going to speak to you, but that's okay. The idea is to learn which ones do and which ones don't. The only way we know how to do that is through the use of trying and, finding new ways of doing things. And by listening to people who are experts and have been doing this for a long time. My best thinking got me into some pretty crazy places. And so when I don't know, I ask and I go, well, I don't know, but I'll give it a shot because it may be these people that I trust are giving me some good ideas of interventions to try.
yeah, and to your point about, being uncomfortable and making the changes. So, a lot of times I will say to the primary person with the addiction is that, you get comfortable being uncomfortable. And it's the same way for the families. As uncomfortable as it is, it's familiar. So you get comfortable being uncomfortable. What Diane and I are trying to do is get you over to a place where you're comfortable being comfortable in spite of whatever is going on. But between those 2 points is where it feels very foreign to you. It's a new feeling because we kind of identify as people in terms of how we feel, whether it's good, bad, or indifferent. This is who we are. So in that middle part, it's almost like you're uncomfortable being comfortable. And when I say that to a person with addiction, you're uncomfortable being comfortable, meaning you're uncomfortable not having your drink. For the family member, you're uncomfortable being comfortable in not falling back into the same mindset of worry and ruminating and having your happiness contingent upon something outside of yourself. So we would love to say, it's just a flip of a switch, but it took you a long time, to get to this place, and nothing's changing. And so what I see a lot of times is contempt without investigation. Oh, I'm not going to try therapy. That's not going to help anything. That's not going to change anything. Well, I think you're really, putting some chains on yourself. I always say to people, hey, it's just a blink of an eye in terms of your lifetime to give this a try. If things don't get exponentially better, within 2 or 3 months for you or for the person that's suffering, you can always go back to, that the way you were doing it before.
Yeah, we like
I
to
don't
say
want
we'll
you. I don't
refund
want
your
you to.
misery. We'll
Yeah,
refund your misery.
yeah. Go
Just
out and do
kidding.
some more research. But no,
Yes,
no, I mean, we have to laugh about some of these things because, otherwise I think we get too serious about it, and it really consumes us. It really consumes us to just focus on any disease that a family member may have. And, life goes on. The reality of it is sometimes we're going to get sick, we're going to get better. You're going to get sick, we're going to get better. But with this disease of addiction, I like it because it's the one that I can keep in remission if I do what's suggested to me by professionals like Di or people that are in the rooms or even myself. Um, and that is different than a lot of other illnesses where, things can be manageable and then all of a sudden they're not manageable through no fault of your own. So, of all the illnesses out there, this is one where we may be powerless over the drugs or the alcohol, but we are not powerless over choice to follow the suggestions that are made by professionals and apply them to our lives and see the results. They will definitely be better than the results you're getting by using. So,
exactly. So the point that we're trying to make today is we'd like to see people step out of their comfort zones and understand that it's not a one size fits all. We'd love to work with people who are willing to try different things and see how it best works for them. Really important. We love that, we've seen so many people progress and move in a direction that are beautifully healthy, functional behaviors that they never dreamed, they could have a life that was possible like this. So Brian and I are going to keep encouraging people to reach out to us, to, ask questions, to try different interventions, try to believe in the experts that they know what they're doing and that, there are many, many different opportunities for both sides, both the family members themselves and the one who is addicted to become wonderfully healthy, beautiful lives. And it's all because there are so many more choices out there today, and that they're willing to do the work. And so, anyway, we're always available if you want to reach out for a free consultation. Our website
yeah, and I
is,
wanted to say that too. I mean, the thought process behind a free consultation is that I think it makes it more accessible, for those of you that are reluctant. It's a free consultation. It doesn't cost you any money. You can get on with Di and myself. We can let you know we feel like we can help you. If we don't feel like we can help you, we will tell you. And vice versa. If you have an affinity for what we have to say and do. So again, there shouldn't be any barrier to you reaching out. And that's the way we want it because we know that it can be intimidating to reach out for help.
absolutely. Thanks, B. I appreciate that. I wasn't even, that's a nice, it's true, we're here for you guys. There's also a free resource pages on our website where you can just sign up and get all kinds of free information on different topics and different things that might be of concern for you. We're here. We are passionate about what we do, and our goal is to help people get through this and get to the other side and move on with their lives and have that, whatever it is that they choose for themselves. So as always, B, thank you, thank you for being here and being a part of this with me today. And
Thank you, Di, and thank you, Di. And the one message I wanted to get out to everybody: there are no hopeless cases. Okay.
Oh,
I just
true,
wanted to say
true,
that.
true, true, true. All right. Thanks so
Alrighty.
much. We are
Thanks. I
Healing Families Shattered by Addiction, and we always welcome you. Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.